Hello, good day to you and welcome. Dairy foods are one of the darlings of the nutrition industry, often heralded as an excellent source of both protein and calcium, which they are. But on the other hand, there is often a devil in the dairy that might be promoting some of your patients and clients' frustrating symptoms and perhaps downstream disease and dysfunction. Anything from acne to chronic postnasal drip to anxiety, autoimmune disease, and more. Today, I'm going to be sharing with you 8 common myths and misunderstandings about dairy foods, specific ways in which dairy foods ranging from milk to yogurt to cheese, and in some sugar-laden forms like ice cream and a rich variety of desserts, ways in which dairy foods might actually be holding back your patient's clinical progress. And number 8 is the most important one, so please stay tuned for the whole list. So let's dive in. Welcome to Functional Medicine for Real-World Impact, where we're diving into the complex, interconnected nature of health and disease, exploring not just theory, but practically what it takes to turn functional medicine insight into powerful, practical, real-world results. So please hit subscribe and let's get started. The reason many of us, the public and practitioners alike, often assume that dairy might be an issue is because of lactose intolerance. We understand that this is a common issue. Many practitioners, however, are surprised to learn that it's much more common than they may have believed. Depending on the study you reference, lactose intolerance in adults occurs in 65 to 75% of the worldwide population. This means most people, the default is going to be that a person is indeed lactose intolerant. And this speaks to the difference in our ability to well digest lactose, the dominant sugar found in dairy when we are children. But the fact that this digestive capacity often wanes as we age and becomes absent in adulthood. It does vary, however, by geography. For example, in Northern European populations, the presence of lactose intolerance is generally much less common and found in 15, 20, 25% of the population. But in Asian and African populations, for example, the prevalence is much higher, 70, 80, even 90% or more. And when we have lactose intolerance, it simply means that we do not maintain the production of lactase in our brush border of our intestines. We obviously have to have the digestive capacity to degrade various foods in order to isolate nutrients for absorption and then excrete waste products from that food with minimal GI distress. If I have lactose intolerance because I'm not making adequate lactase in my gut, then symptoms such as diarrhea, gas, flatulence, bloating, cramping are the common symptoms. And these, of course, can be of widely varying severity, from episodic to chronic but mild and easy to ignore, or they can actually be really quite severe and a major contributor to IBS type symptoms and diagnoses. And so the point here, number one, around the devil in the dairy is that lactose intolerance is incredibly common. Yet we often, especially here in the US, lean on lactose containing foods as being a major component of our diet. And it's likely leading to quite a bit of GI distress. Number 2 is about immune hypersensitivity to dairy. And this is quite different from lactose intolerance. Many practitioners get confused about the difference between a gastrointestinal enzyme deficiency, which is lactose intolerance, versus an immune hypersensitivity to components found in dairy foods. And this is usually to proteins in foods and is often either to whey or to casein. And like any other food, the immune system has a number of different pathways via which it can react negatively to a food, treating it as though it is a threat, a potential foreign invader, and something worth getting inflamed about, and as a mechanism of defense. We are well familiar with the concept of allergies, which are usually IgE, antibody mediated in the body. And indeed, dairy allergy is a known dynamic and certainly one of the most prevalent allergies affecting very young children. But other immune hyperreactivity to dairy can happen via IgG antibody reactivity that also triggers the complement cascade that sets off inflammation. It can be via IgA antibody reactivity. That is our predominant antibody in our mucosa, our mucosal membranes, especially in our gut. And when we have maldigestion to foods, to dairy, whether it's because of suboptimal stomach acid for denaturing proteins, or maybe suboptimal digestive enzymes coming from the pancreas, maybe if we have any stage of metabolic disease, foods we don't well degrade are much more likely to be immunogenic. And we have other podcast episodes where we talk about food sensitivities, which is a topic I highly encourage you to become quite conversant about and keen on investigating in your practice, because they are often at the roots of inflammatory dynamics in your patients. But immune hypersensitivity to dairy is one of the most common culprits in systemic immune symptoms. And I want to encourage you in particular to think about your patients who struggle with histamine overload, whether it is chronic postnasal drip, frequent respiratory, nasal congestion and infection, fatigue, joint pain, and perhaps swelling, which can happen because immune complexes form with antigens and antibodies, and they can build up in areas of low circulation like our joints. We also can have skin challenges because of immune hypersensitivity to dairy, whether it is acne or histamine-mediated skin challenges such as eczema or rosacea, for example. But we certainly can test for immune hypersensitivities, but the gold standard for any immune reactivity to a food is structured elimination and reintroduction. But for your patients who wrestle with a variety of chronic inflammatory symptoms, don't forget to think about food, and even a gold standard food that, like I said, is so often heralded as a centerpiece in the healthy diet may actually be the culprit in setting off these inflammatory symptoms. Now, for number 3, I want to dive into some of the nuances around dairy foods. Many of your patients may ask about the difference between cow dairy versus goat dairy or sheep dairy. Sometimes individuals explore different dairy foods and find that, oh, well, I get really tired, or I have skin issues or joint pain or congestion issues if I have regular cow milk. But if I have sheep's milk, I don't seem to have those symptoms, or I don't have as many of them. And indeed, there is good science behind that observation because, of course, dairy foods coming from different animal species is going to have different protein makeup. And cow dairy in particular presents with A1 and A2 beta caseins. And the particular type of casein protein depends on the breed of the cow. And I'll share more details with you about that in just a moment. But suffice it to say that sheep dairy and goat dairy, first of all, have higher levels of whey protein in them as opposed to casein protein. But the particular caseins prevalent in a goat and sheep and even some other like water buffalo or camel dairy are much less likely to be pro-inflammatory. Now, notice I didn't say that it's not possible for them to be pro-inflammatory. It's just less common. And so some of your patients may find that they tolerate sheep or goat dairy. But keep in mind that individuals can have immune hypersensitivity to whey or casein. If casein is the particular protein the immune system is upset about, then changing up the herd, if you will, may make a big difference. But if individuals are reacting to whey, it's highly likely that all dairy foods are likely to present a pro-inflammatory trigger. The next thing I want to do is dive in on number 4 to some of the distinctions here about cow dairy, because I mentioned earlier that cow dairy includes either A1 or A2 casein. And some of the biggest pro-inflammatory challenges found in dairy foods are as a result of A1 beta casein, which is found in milk and other dairy products coming from some of the cow breeds that are much more dominant in Western Europe, in North America, and in Australia, including, for example, Holsteins. And A1 beta casein is an issue for many people who have immune reactivity to casein. But in particular, some individuals produce an enzyme that degrades A1 beta casein in a particular way that it creates a particular peptide metabolite, and that is beta casomorphin 7, BCM7, beta casomorphin 7. This can only come from A1 producing cows. And so individuals who have this particular genetic type of enzyme production are especially vulnerable to histamine overload from dairy consumption and also to potential cross-reactivity between dairy proteins and innate human proteins that could possibly set us up for autoimmune disease activation over time. And so BCM7 is widely recognized as being an inflammatory peptide. And individuals in your practice who are committed to educating themselves may ask you at times about the difference between A1 milk and A2 milk. And there is a key difference here because A2 casein is not only produced by goats and sheep, but also by other cow breeds, including Jersey cows, and some of the breeds that are much more prevalent in cow food production in Asia and in Africa, for example. And increasingly, you can find A2 milk. And in some cases, individuals may find that they do not tolerate the typical unlabeled milk in the U.S., which is almost guaranteed to be from A1 producing cows. But if they seek out A2 dairy in particular, they seem to have no issues and their pro-inflammatory symptoms seem to fade away. And this is where, again, the devil can be in the dairy, not only in the food itself, but in the particular animal that's producing it, the particular breed of the animal that's producing it, and their particular digestive capacity and what might be produced downstream from these food-based proteins that are setting up inflammation in the body. So again, something to think about in your individuals who have histamine overload in your practice, like eczema and psoriasis, various types of atopy, chronic allergies, individuals with autoimmune disease. Thanks to a lot of the research of the doctors Vojdani in the functional medicine world, we know increasingly that there's a very high association between elevated antibodies to dairy and a number of different autoimmune diseases, from type 1 diabetes, often diagnosed in children, to celiac disease, lupus, multiple sclerosis, rheumatoid arthritis, and more. even some interesting other disease dynamics that we don't always assume are autoimmune in origin, like endometriosis or other inflammatory dynamics like eosinophilic esophagitis. We need to think about whether or not dairy might be a culprit. And the best way to determine that is to simply go through a cold turkey elimination, 100% elimination, not reduction, but weeding out all of the dairy foods and doing a structured extended elimination and then reintroduction and allowing an individual to explore and see how their body responds. Devil in the dairy, point number 5. Unfortunately, we have learned that not only is dairy in and of itself potentially a trigger for immune hypervigilance, dairy has within its proteins some amino acid sequences that are quite similar to other foods, in particular to gluten. And this means that individuals who don't tolerate gluten for a variety of reasons, right? They might have celiac disease, they might have a gluten allergy or a wheat allergy, they might have IgG or IgA mediated immune hypersensitivities to gluten. In any of those scenarios, dairy may also be triggering those same gluten sensitivities because of what we call cross-reactivity. This is really because of this amino acid similarity where the immune system sees one protein as being similar enough to another one it knows is a threat, and it simply chooses to get inflamed in response to both. And this may be, again, even an even more prevalent or debilitating issue if an individual has maldigestion from the sources I mentioned earlier, right? Stomach acid, pancreatic enzymes, brush border enzymes that are produced in the lining of the intestines. But beyond maldigestion, I also want to encourage you to think about the likely significant number of people in your practice who have lost gut barrier function. They have mucosal degradation in their intestines. And this has led to what we often call EIP, or enhanced intestinal permeability. The gut lining in our intestines is naturally partially permeable. Of course, we want to be able to get nutrients into the body. We need to get waste products out of the body back into the intestines. This bidirectional exchange corridor in the gut. But this is supposed to be a precisely controlled semi-permeable membrane. And for a rich variety of reasons, individuals can end up with enhanced or excessive permeability in the gut, where what should stay in the gut is actually allowed excessive exposure into the basement membrane of the intestines, down into our gut-associated lymphatic tissue, where it's more likely to stimulate an aggressive immune response. Or even with enough permeability, what happens in the gut is able to leave the gut and actually seep into circulation and very often trigger an inflammatory response, and then a risk of systemic symptoms. Again, anything from mood challenges like anxiety or depression to brain fog, acne, metabolic dysfunction, autoimmune disease, a rich variety of these. So if you know that your patient is struggling with enhanced intestinal permeability, think even more keenly about the likelihood of food sensitivities, because when we have a leaky gut, then we are more likely to be overexposing our immune system to partially digested foods. And where inflammatory symptoms might be being driven because of this loss of gut barrier function. But this cross-reactivity between gluten and dairy proteins can mean that many more individuals may find that dairy food intake is a trigger for their challenges. Number 6, let's talk more about symptoms and suffering associated with the devil in the dairy and how you can sleuth this out in your practice. As I mentioned earlier, most of us are familiar with the classic symptoms of lactose intolerance. It's the GI distress, especially the bloating, some distension, and usually marked flatulence. Looser stools, even if they're still formed, they might be quite loose, or individuals might actually have diarrhea. And this is an issue because, of course, GI symptoms may be debilitating, but they also may set us up for other GI dysfunction downstream. And so what begins with lactose intolerance may become more advanced GI distress and symptoms. But dairy immune hypervigilance can potentially set up with a very different type of symptoms and suffering. And what is of a special note, that individuals who have dairy sensitivity are much more likely to have constipation than diarrhea. And in fact, if individuals have both lactose intolerance and dairy sensitivity at the same time, they may have seemingly perfect bowel movements because there's a reaction to the lactose intolerance that is increasing transit time, but then there's a reaction to the immune hypervigilance against dairy that is going to slow transit time. And that faster time and that slower time combine to create a seemingly perfect bowel movement. It doesn't mean that dairy is not an issue. So we want to not assume that perfect bowel movements rule out food sensitivities of any kind, including dairy. In fact, many food sensitivities don't have any GI symptoms of inflammation at all. As I've mentioned here and there, I want to summarize for you some of the symptoms in particular that I encourage you to always question whether this is being driven by dairy. In particular, acne, in part because dairy proteins can be a trigger for higher levels of insulin-like growth factor 1, IGF-1. And this, as it builds up, can be a trigger for the development of acne. All histamine overload type of dynamics, nasal, respiratory, congestion, and risk of higher infections. This also can spread through the eustachian tubes. And I encourage you to think about dairy hypersensitivity for your patients, especially children who have frequent ear infections or trouble hearing because of clogged eustachian tubes that requires them to get tubes put in their ears in order to allow drainage so that they can better hear. Sometimes individuals are presenting well into adulthood with this particular childhood challenge. That should be a red flag in your mind. You always want to think also about individuals who crave dairy. They talk about cheese, for example, like it is just a dear friend and something that they daydream about, something they can't wait to eat again, something they frequently crave. And this is because, first of all, often we crave the very foods that we have immune hypersensitivities against. It's another clinical pearl for you. But it's also true that dairy foods are degraded not just into the pro-inflammatory BCM7 casomorphin I mentioned earlier. In general, multiple types of casomorphins are generated through the digestion of dairy. And as you might have caught in their name, casomorphin, these are morphine-like opiate stimulating byproducts from dairy digestion. And some individuals, especially if they have enhanced intestinal permeability that allows for greater systemic and likely brain and central nervous system exposure to this dietary debris, we, of course, may crave foods that we feel are calming to us. And some of your patients crave dairy because they're getting a significant mood balancing effect from these casomorphin byproducts from digestion. I also encourage you in every patient case of autoimmune disease to consider, is gluten a major mediator of enhanced intestinal permeability in that individual? that is leading to immune dysregulation because of that loss of barrier function in the gut? And is dairy possibly also a problem because of this cross-reactivity, this amino acid sequence similarity between dairy and gluten that might be, again, stimulating higher levels of zonulin and potentially inflammation in the gut that is causing mucosal degradation in the intestines and leading to this enhanced intestinal permeability that is commonly at play in autoimmune disease. So a number of different presenting symptom puzzle pieces that you can use as a red flag to question and explore whether dairy is a trigger. Now, number 7, I think is an important thing to understand. Many of your clients, especially potentially women as they age, are very attached to their dairy intake because they've been told that it will prevent osteoporosis, or it's the best way to get calcium in order to prevent bone density loss. And I think it's important for us to understand that there are entire populations of people around the world who, as I said earlier, have a high prevalence of lactose intolerance. Dairy foods are not part of their cultural food choices at all. And yet these individuals in many cases have much higher bone density as they age than Americans do. As I like to say, they still have Olympic teams and are very strong and hardy in constitution. And unfortunately, we have a lot of myths about the necessity of dairy foods in order to create strong bones that are, let's face it, often promoted by or even fully funded by organizations that stand to gain financially from that message. And I will say that myth. Because research does not at all point to a strong, consistent association of more dairy food equals higher bone density, or more dairy food intake is associated with lower and lower fracture rates of major bones in the body as we age. In fact, that is not true at all. And in fact, it often some of the highest fracture rates, like for hip fracture, are shown in studies to be associated with the highest intake of dairy. And it's hard to pinpoint the impact from a nutritional viewpoint of some of these studies because there's so much variety involved, right? Was the study involving a society that primarily consumes A1 beta casein or A2 containing cow milk? Or is it more likely to be yogurt, which is cultured and more denatured dairy food than milk, for example? There's a lot of variability in these studies, but for sure we need to move away from the myth that in order to be responsible as a parent or an adult, it means consuming lots of dairy foods on a regular basis, because data does not show that to be necessarily the case, and certainly not a requirement. And number 8, I think is critical, because if you are inspired by what I'm sharing today, and you're going to look more often for when dairy foods may be a culprit in driving your patients and clients' symptomatic suffering and then their downstream disease, we need to learn that dairy is often hidden. It's easy to tell your patients to not consume milk and cheese and ice cream and yogurt and butter, for example, for comprehensive elimination of dairy. But the average person, at least in the US, consuming the standard American diet is also, beyond those whole foods, consuming all sorts of different cookies and crackers and rolls and wraps and buns and highly processed snacks and desserts and frozen dinners and processed meats and bars and powders and shakes and seasonings and sauces and dressings. And the reality is, until we learn to read labels and identify the common sources of dairy, then your patient, even though they're eliminating the whole food sources of dairy, may still be getting regular intake of casein or whey. And in fact, you might be surprised to learn that even in the US, right, the FDA Code of Regulations for Food Labeling allows companies to put non-dairy on foods that still contain casein, such as sodium caseinate, which is a ubiquitous ingredient in non-dairy creamers. And so we can't be, we need to be vigilant, rather, to not be misled by labeling on the front of the packaging of a product, and instead look at the back of the labeling where the ingredient list lies, and look carefully for anything that contains any type of casein or caseinate or other milk-derived protein derivative, including whey, if we're going to have a thorough, comprehensive, and therefore helpful food elimination experience as part of your clinical plan. So there you have it for today. 8 common ways in which there can be a devil in the dairy in the diets of the people you serve in your practice. Now, absolutely, there are people who thrive eating dairy foods. There are no universal pro-inflammatory foods that we can point to. Certainly, there are all sorts of chemicals that we find in all sorts of processed and ultra-processed foods. But when we're looking at inflammatory culprits in whole foods in our diets, we need to remember that even nutritionally rich foods like dairy may be wonderfully health promoting for some, but disease promoting for others. And this is that foundation of bioindividuality that can make all the difference in your ability to help a unique person get well, transcending the limitations of one-size-fits-all protocols in order to customize your approach for each unique person you support without overwhelm. So I thank you for joining us today and exploring how diet may actually be one of the true root causes of disease for the people you're passionate about supporting. Thanks for joining us. Have a great day.